What does it really mean when I'm talking about breast implant placement and breast augmentation, and specifically above or below the muscle? Well, I'm here to break it down, and as always, if you have any questions at the end, please let me know. I think the key thing to know is that we have the pectoralis muscle, and that's the key anatomic thing to determine whether it's above or below the muscle, along with some subtle variations. So the pec muscle actually starts around your shoulder, goes down towards your sternum, the middle of the chest, as well to the bottom of the rib cage. And that's where the actual distinction is made, where we place your actual breast implant. What's interesting about the pectoralis is that it does not fully cover the side of your chest. So specifically pushing towards your underarm, there's actually little to no pec muscle. And this is where some of the confusion occurs in terms of language, but I'm here to make it easy. So I think the easiest thing to understand is what we call subglandular, which really means above the pec muscle. So we're above the muscle, we're above the fascia, we're directly underneath the skin and breast tissue, and this is where, in theory, we can put a breast implant. In reality, this is not a very common place to put a breast implant because you're at increased risk of capsular contracture, slightly increased risk of infection, and since there's not much padding over the actual implant, we don't really love that overall placement. Now, bear with me. We're gonna go straight forward to under muscle placement. So what I need to do is lift up the pectoralis muscle. I need to create a circular pocket for the implant, and I need to put the implant underneath it. Under the muscle, or sub-pec, is a little too easy to state. We as plastic surgeons love to be a little more precise, but also use confusing terminology. So what we call under the muscle is really dual plane. So why do we call it dual plane? Now, you may remember I told you that the pec muscle isn't like this big vast sheet of muscle that covers the underarm. At the underarm area, it actually thins out and becomes nothing. There is no pec muscle in the axillary underarm area. Technically, when I'm creating a circular pocket for the implant, yes, I'm pretty good under the muscle, sort of in the middle, but towards the sides, the lateral edges, the areas going towards your underarm, you have no pectoralis muscle coverage. So there are two planes, a dual plane, covering your actual breast implant, the muscle and your soft tissue. This is why we as plastic surgeons call it dual plane, and this is why you as a consumer have no concept as to what we're talking about. But essentially, that's what we're talking about. The dual plane has a bunch of advantages, including a little more tissue coverage, because relying on the skin, breast tissue, and muscle to cover your implant, there's a little more padding there. The other thing is that it definitely reduces the risk of capsular contracture, a rare condition or uncommon condition where you can have a little too much scar tissue form around the implant. That makes it a little thick, a little unnatural feeling. So anything to help with that really overall helps your aesthetic results. It is a very well-controlled pocket, so we can actually see everything. We can create that circular pocket very precisely, which is what we like. There's a downside to it. It does hurt a little more because we're stretching out the muscle. Remember, it's under the muscle. We have to put the implant in. It's going to stretch it out. Weirdly enough, that actually causes most of the pain with breast augmentation as opposed to any incision. That's why dual plane is so popular, and also this is why dual plane is considered dual plane and not truly subpectoral, like under the muscle placement. There is a third option, a bit nerdy, but bear with me. It's called the subfascial pocket. In case you didn't know, muscle always has fascia, sort of this thin white, sometimes it's barely see-through, sometimes it's a thick white covering. And you see this if you eat meat. Well, the pectoralis muscle in the human has that thinnish, whitish, but still tough covering directly over the pectoralis. So if I go underneath the fascia, technically above the muscle, but remember, above the muscle fibers, but under the fascia, and we're still not underneath the breast tissue, because remember, you have skin, breast tissue, fascia, and muscle, and we're going under the fascia. I can actually create a circular pocket for the implant, and that is called the subfascial approach. This is a great approach because it's still technically not exposing your implant to any bacteria which are in your breast tissue, but we still have that nice soft feel. And also patients definitely have quicker recovery because remember, we're not stretching out the muscle, it doesn't hurt as much. Stretching out the fascia actually has little to no pain after surgery. So this is why I love that approach. So there is a big disadvantage with the subfascial approach. One problem is that sometimes there may not be enough breast tissue or really padding over the actual breast implant. That is a concern. That's similar to what we have with a true, pure, above muscle placement subglandular. Now, there are considerations with any approach, and this is where we have some modifications or different ways of thinking between directly underneath the muscle, subglandular, under the fascia but above the muscle, subfascial, or truly under the muscle, dual plane. I think the biggest concern is really your activity levels. If you're more active, and definitely if you're into lifting weights, you want to place it not under the muscle, not dual plane. We want to be able to have your pec free and be able to move. Also, we do think that constant pressure of your pectoralis activating and generating a lot of force, if the implant's underneath the pectoralis, then it just squeezes the implant, and that's not really great for long-term implant longevity or how long it lasts. Another important consideration is aesthetics in terms of feel. So specifically, this may sound strange, but the more padding you have over your breast implant, the more natural it feels and the more natural it looks. Breast augmentation patients often have very little to no breast tissue. Some patients have very little to no body fat. So we definitely, in general, want a little more padding to give you a better overall look and a better overall feel. One way to do this is to do fat grafting. In case you're very thin and you have very little breast tissue, you may need a little fat grafting to generate some padding or to give a better overall shape, as opposed to just the sharp outline of your breast implant. There is something known as rippling or wrinkling, where you can see or feel the edge of the implant. This is especially true if you have an implant that's placed above the muscle and it's a little too large for your body frame, and you have low body fat, and you lean over, and sometimes you can see or feel the rippling or wrinkling of the actual implant or the outline over at the side near the underarm. There are a bunch of ways to help reduce this, including making sure you pick the correct implants, the implants that I think are slightly overfilled, pick silicone implants over saline, place them underneath the fascia as opposed to above the fascia, and we can actually do fat grafting. There are a couple other things or considerations regarding rippling and wrinkling, but those are the major ones, and that's something that can be eliminated or made to look better even before you have your operation. Another consideration is cleavage. So I definitely find that placing it not under the muscle, I'm able to actually create better cleavage. In other words, inter-mammary distance, how close the implants are or not. If they're under the muscle, in other words, dual plane, I do create a very precise pocket, but I have to change my technique a little so that you can actually see cleavage long term. That is a consideration, and definitely talk to your plastic surgeon about it. So currently, the most common placement around the world is actually dual plane. We know it, we like it, it's a known quantity, it's being taught everywhere. And for many years, I did dual plane. I do think that the future is subfascial, or underneath the fascia, because I love the control. I love the fact that I can generate a little better cleavage. And finally, in terms of patient comfort, my patients definitely recover more. Also, I think this may be a trend among my patients, but I think that people are more active. So even if they're not lifting weights 6 days a week, they're still doing upper body exercises, things of that nature, swimming, tennis, pickleball, other things that require upper body muscle movement. If you have that type of lifestyle, I do think that it's better in terms of not just short-term comfort, but actually long-term comfort and long-term aesthetic results to place it underneath the fascia. As always, I have other videos that you can check out, and please check them out here on my YouTube channel. If you have any other videos that you want me to talk about, please drop a comment below. If you have any questions or concerns, drop a comment below. And as always, thanks for watching.